Hello again. This week I finally made the time to construct a brief PowerPoint presentation to help walk me through this week's prompts, but unfortunately for the life of me I could not figure out how to record myself as I walked through the PowerPoint presentation. I'm still going to be using the PowerPoint presentation that I constructed, but I'm still having to record from my phone, so just bear with me. Hopefully before next week I'll get this figured out. It's a work in progress, but I appreciate the grace that you've shown me thus far. So this presentation is titled Adjust to What? So what are people adjusting to when we talk about adjustment disorders? But before we dive into this week's questions, let's figure out exactly what adjustment disorders are. According to the DSM-5 5th edition overview study guide that I use, adjustment disorders are the appearance of emotional or behavioral symptoms as a reaction to definitive stress-inducing events, with such symptoms appearing within 3 months of the event. And that is the 2022 5th edition DSM-5 overview. Now, if your brain works anywhere like mine, that definition may have come across a little bit too complex. I tell people all the time, I may be a grad student, but I still prefer people to break things down in layman's terms. So I did a brief Google search on adjustment disorders, and I found a little bit simpler definition of adjustment disorders, and this one is described as an emotional or behavioral reaction to a stressful event or change in a person's life. The reaction is considered an unhealthy or excessive response to the event or change still happening within that 3-month period. So it's basically an unhealthy response to a stressful event or change in a person's life. To me, that definition was much easier to comprehend, and that was derived from Johns Hopkins Medicine, originally published in 2021. So we have our definition of what an adjustment disorder is. Now, some key factors that go along with adjustment disorders are, again, the 3-month period, the development of emotional or behavioral symptoms within 3 months of the initial stressor or event, and that is taken from the DSM-5 5th edition of 2022. Another key factor are symptoms or behaviors are clinically significant as evidenced by one or both of the following. And this is distress that is out of proportion to the severity of the stressor, and also significant impairment in social, occupational, and other important areas of functioning. Again, these are also taken from the 5th edition. Some specifiers that go along with the adjustment disorder are depressed mood, which include low mood, tearfulness, and feelings of hopelessness. They're all predominant. Anxiety, which are, nervousness, worry, jitterness, and separation anxiety, and disturbance of conduct. Again, these specifiers are also derived from the 5th edition of the Diagnostic Manual. It is worth noting that with these specifiers, the symptoms cannot persist for more than 6 months after the termination of the initial stressor or change. In other words, by definition, an adjustment disorder must resolve within 6 months of the termination of the stressor, the initial stressor. From a diagnostic standpoint, what really sets adjustment disorders apart from all of the rest of disorders that we've covered this week, the stress-related disorders that we've covered this week, what really sets it apart is the prevalence and presence of emotional and behavioral symptoms in response to a stressful event. Adjustment disorders, according to the DSM-5 5th edition again, adjustment disorders may be diagnosed following the death of a loved one when the intensity and quality or persistence of grief reactions exceeds what normally might be expected. Cultural and religious and age-appropriate norms must also be taken into consideration from a diagnostic feature standpoint. Again, the main thing to keep in mind from a diagnostic feature standpoint are the prevalence of emotional and behavioral symptoms. Now, moving on to why is it important to have specifiers and modifiers? Well, again, just like any other diagnosis, it helps us with differential diagnosis, especially when the symptoms between acute stress disorder and PTSD, complex PTSD, and adjustment disorders, they all seem to overlap. So these specifiers, like the time frame of adjustment disorders, the 6-month time frame, that is really needed for us when we are trying to make an appropriate diagnosis, because again, without an appropriate diagnosis, we can't expect to have proper treatment. We can't construct proper treatment plans if we have the wrong diagnosis to a patient. Specifiers and modifiers also include the severity and the duration and frequency of these symptoms. These all must be taken into account when making differential diagnosis between disorders like PTSD, complex PTSD, and adjustment disorders. It's been another fun week, and I'm looking forward to finishing strong. Hopefully by next week I'll be able to figure out how to record directly from the computer while I'm working through a PowerPoint presentation. Thanks.